Well, we have a lot to cover, so let's go ahead and cover it. We're going to talk specifically about the blood tests for heart disease. First, let me just explain to you what's sort of happening in the body when we're talking about VLDL, IDL, LDL, HDL, all these things. I'm going to give you a very brief understanding of what's happening, because if you understand this, it's much easier to understand these tests. In your brain, you'll know what's going on. So in your liver is where VLDL is created. What is it made of? It's made of triglycerides and cholesterol. So VLDL is essentially a carrier. It takes it into the bloodstream, and as you have triglycerides being dropped off to tissues, this would be like working muscle. Why would triglycerides be dropping it off to working muscle? Because triglycerides are a great source of energy. So as it loses triglycerides, it becomes IDL, meaning intermediate density lipoprotein. So it gets lighter. What's left is more cholesterol. So the combination of triglycerides and cholesterol, as it goes through the bloodstream, the body starts dropping off triglycerides. Eventually becomes LDL. And LDL is dropping the cholesterol to tissues. Why? Because LDL forms cell membranes, and it forms your hormones. We've talked a lot about this in past UTCs. For some of you, this is a review. But I just want you to see what's happening here. In the liver, VLDL, which is it's like the truck that's going to transport the triglycerides and cholesterol, and it's going to drop off triglycerides to tissues for working muscles. And then you say, but Tom, I thought you said triglycerides are stored as fat. Remember, we talked about the fat burning process. Yes, when you have extra triglycerides, these extra triglycerides get stored as fat. Okay, that's what happens. Once you drop off triglycerides, the IDL turns into LDL. So now you have low density lipoprotein. That cholesterol gets dropped off into tissues. Why? For the purpose of cell membranes and hormone production. Now, let's just pause here. Tom, you're telling me that LDL is important for cell membranes and hormone production? Yes. Those of you that are on certain medications for your cholesterol, remember we talked about the risk-reward of medications, how there's a give and a take. Some of you are on very powerful statins, or maybe you're on Repatha, which works differently, specifically in the liver, but it can crash your LDL levels. And you may wonder, does this affect your cell membranes and your hormone production? Absolutely. I guarantee you, if you're, for example, a man or a woman, if you check your hormone panel, I guarantee you that your hormone panel, you'll notice a drop once you're on these medications. But just recognize that the cell membranes of your body are also affected to some degree. LDL is also implicated in the immune response in your body. So when you have inflammation going on in the body, LDL, we know, has real benefit to keeping you alive from other diseases. So for example, if a person is being treated for high cholesterol and everything else in their body is normal, meaning their blood glucose is normal, their blood pressure is normal, etc., normal body weight, and if you treat them with a statin, we know that they will be less likely to die of heart disease, but they will die sooner of something other than heart disease, which is showing you that LDL is there to protect you from other diseases. So this would be things like cancer, etc. The LDL is very important. I'm only bringing this up because I just want you to understand that not everything is as simple as taking a pill. There's a real benefit to understanding what's happening here. So now, what happens to this extra LDL? Well, let's follow it around. This extra LDL can get into the blood, And when it gets into the blood, the danger becomes, will it get into the arterial walls? How does it get into the arterial walls? There has to be damage to the arterial walls. How do they get damaged? I'm glad you asked. Let's go down here. All these things that we talked about in the UTC, it would be high blood pressure over time. So if you're creating a lot of pressure in the vasculature of your body, it's like a hose that starts to tear slightly. And your body, using its immune response, will start to put LDL particles into that endothelial wall. How else does it happen? It happens through high blood sugar. And we're going to talk a lot about blood sugar, but just a very short answer here is it starts to stiffen those arterial walls, which obviously makes them easier to crack. Chronic long-term inflammation for the same exact reason. So if you have these things going on, you're much more likely to have this damage to the arterial wall. There's nothing wrong with raising your blood pressure for a workout. What we're talking about is sustained high blood pressure over time. It's the same thing with high blood sugar. It's normal for your blood sugar to raise after you eat. It's that high sustained blood sugar over time. Same thing with inflammation. You inflame your body when you exercise, and that short-term inflammation is a very good thing. It's that long-term chronic inflammation that never goes away that's a problem. So these particles get oxidized, and when they get oxidized, that's where you start getting real problems with possible stroke, heart attack, etc. Now, all that stuff, these triglycerides, this cholesterol, eventually gets recycled back to the liver. What helps it get out of the bloodstream? So mind you, this extra stuff that's circulating, when you get your blood work done, you see triglycerides are high. But Tom, you told me that it gets stored as body fat. It does, but there's still so much extra in the body that it's telling you that essentially you're overfed. In most cases, this is what's happening. There's some genetic disorders, but essentially you have too much energy. So when there's high triglycerides, your body says, hey, let's make sure that we repackage this to more VLDL. And why would VLDL be very high? For all the same reason. Your body's working extra hard to clear all this stuff out. HDL, why is HDL considered the good cholesterol? It's because it helps transport this stuff back to the liver. Okay, that's why HDL is protective. But in general, most of heart disease that's why it's like an overfeeding problem. That's why obesity leads to more heart disease. Because it leads to higher blood pressure, it leads to higher blood sugar, or it leads to long-term inflammation, and it leads to all these markers that we're seeing here that goes in a circle. So when we do your blood test, you're going to notice in the manual, it talks about total cholesterol as a test. This sucks. This is a horrible test. It's not telling you much. It's telling you the combination of HDL, LDL, and VLDL. It does not include lipoprotein A, which I'll explain in a moment. So if you're just getting your total cholesterol checked, you're not getting very helpful information. If you get LDL-C, which is your amount of LDL, meaning the mass of your LDL. So now it's saying this is how much LDL via the mass is in your bloodstream. But what it's not telling you is the number. It's not telling you how many particles there are. That's what LDL-P is telling you. It's giving you a much more helpful number. It's telling you the number of particles, But we know now that particle size matters. So the smaller particles are much more problematic for heart disease. So that's why we're talking about small LDL-P. We want to look at the smaller LDL particle sizes, which you can have measured. The other thing that you should have measured right here is Lp(a), which is not included in your total cholesterol. Lp(a) is just like LDL, but it has an apolipoprotein A attached to it. And that little a there is very problematic for getting under that endothelial wall. Okay, so these things should be measured. We already talked about HDL being protective. So the best thing you can do is go ahead and get your small LDLP measured. So you want to get your LDL particle size measured, small LDLP, and LP little a measured, along with your HDL. This will give you the information that you need to know in terms of risk, as well as the panel up here. You know, your VLDL, your triglycerides, and of course your blood sugar, which would be your A1C is what you want to look at. A1C would be the thing that shows you over time what it looks like over the course of 6 months, your blood glucose over the course of 6 months. Okay, so a lot of information, but I think I covered everything pretty clearly. If you have any questions, feel free to text me, but this is a good foundation so far.